Hi everyone, my name is Tammy Gaines. I am today I just had my wisdom teeth taken out, so my face is pretty puffy and I'm having a hard time speaking, so please bear with me if you can. I wanted to touch on the discussion question regarding cell phone usage and apps in a patient care setting. And so that is the discussion question I've chosen. However, on the topic of informatics and my experience with them, my majority of experience with informatics has been on medical surgical floors and when I worked as an LPN in long-term care. I did have some paper charting experience in the very beginning. But for the most part, I have used computers to either communicate with other medical professionals or chart on my patients, request new labs, and even speak with pharmacy or social workers. So informatics is a pretty important aspect of my nursing experience. Right now, however, I am not working. I am at home with my children. And that is because of the pandemic and everything that's going on right now. I find it necessary to be available when or if the school shut down for my 3 children here at home. 3 of the 4 of my children that are here at home with me. I have had experience on multiple informatics platforms, and the majority of that is in relation to maintaining patient care. But each time I've changed my place of work, I've had to learn a new system. I've used Epic, I've used Point Click and Care, and I've even had to go through other informatics like training or whatever to learn those different systems. In my experience, those systems, some are better than others, but each one I think has been very important and very useful for me when I've been taking care of patients. So an additional way I kind of mentioned before was using training. I've had to give training using PowerPoints or even software developed training systems, either to just do my job or to learn a new system. And I believe that that's a form of informatics and helps us take care of our patients as well. But transitioning to the discussion question, one of the things that I think about smartphones is that they are not only a negative thing, that they can be a positive thing as well. I think that they can be used as a tool, but some of the negative aspects of phones is that they can be distracting from time to time if the person who has the phone doesn't decide to be diligent about their use of it. I've seen some nurses that were so focused on their phone that they didn't hear people talking to them in the same room. They didn't hear call lights go off. And I think that can affect patients' care and it can make things dangerous. If there's a code and you can't even hear over your game or your text messages, then how can you be an effective nurse? How can you be taking care of your patients and have their best interests in mind? That's one of my opinions on it. The other opinion I have is that I think that phones are such second nature to people that they want to take pictures and they want to share about their day and complain. And I think that those end up being HIPAA violations. It's so easy to track where people work nowadays, and it's easy to find out who they took care of with Facebook and other social media. And I think that it's just best that all of that stays off of your phone. I don't think anybody needs to talk about it, and I think people get in trouble for it every day. And it's just not worth it. You losing your license because you wanted to play on your phone or share something or rant. However, some of the positive things that I've seen from phones is that computer systems fail. And nurses, while I think everybody does their best to memorize and remember all treatments and all the medications and all the interactions, I think that sometimes it's difficult to keep up with all that. And having a phone that you can just pop into the nurse's station, find out the information, jog your memory, I don't think that that's a negative thing. I think that that's a positive thing. I think it helps the nurse. I think it makes things safer for patients. More importantly, I've used my cell phone a lot to communicate with other providers. When I worked in long-term care, that was my primary means of getting a hold of my supervisor. We didn't have a phone system that was very effective. And people were bouncing back between halls and here and there, and that's how we got into contact with people the quickest way. It worked for us. Some of the apps that I have used on my phone is called Nursing Central. And the reason why I like Nursing Central so much is that it uses the Davis medication book that we use in nursing school. And because of that, it was an easy transition for me to find medications and look up things to help my patients. It also uses journal articles, and lists those. And I think that was a really helpful tool for me, especially when we started this program, and every discussion post and every paper has to have an article. And I think that it has created a behavior from me where I look up articles to see about treatments or medications and how they're interacting when I'm taking care of patients. And I don't think that my phone precludes me from being able to answer questions from doctors or follow up on orders. I think overall it's more beneficial than it is not beneficial when used responsibly. So that's my opinion, and I welcome everybody's thoughts and ideas on that. Thanks, guys.